Malole se pemia pionga ya po luso titia ye ni kutao matango pio leli ya pa malo foi e la finga renga al tato lekio nai au kila ni nisila pa na due ya mo peon abil be inga matani tanga lu tato tua o tato ge me ko ni ya so me ni tula pa lo tu be sengo fa tenai ngatavlang Petaulang is le tunu a me se po ita po inga mam tina ma tutua wa se ai mo Samoa tau le nei al tanto le tio tu sa o tu me na te te malu si le fie mo lo tu po a fie Samoa lo tau te uam tau le ai le ngo Samoa le nei po ia tunu upu masani mai lava le te ba e iona pulu tau ni ma wasi na pando ta ua lava e se tasi po i o tamaitai Samoa, Hawaii. E whantara noa ai, se tasi o po mai fōu lava to a whai mai nei, ili masina nei o JUN. Ma la whai atu mata noa ngan wha Britania o na o le ngana lea e lava i eilo ni si le fia e manino ai fōi tatu tananga mai vave ai fōi. O le foi on soifua maula o ia ki tonu o le nei tinu United America ia ai amata whapea o le tinapa o Dr. Tiare Sanoe Laufou-Nakashima o le alo siwa i Laufou ma le whaletua o Reima Laufou na whanau le motu o ahu i Hawaii tuputupu maula e le motu o Maui i Hawaii. Na onga i la onga mawalunga o Kamehameha Schools i Maui, le ruafe Malawalu, le ruafe Sulima. So oi ma le University of Hawaii i Maui, le Maui College i le ruafe Sulima, i le ruafe Sulvalu, ia ma le Grand Canyon University i le ruafe Sulvalu, i le ruafe Luasfulu. Sa ielo na whaamoi moe a vea na ta maitai tausi mai nurse e pe o langa tina o Reima. Ia au lea, o oi po i se manatu. Si kia tu ia manon ainga lon to do Daniel i state of Arizona ia ma o ngai university o AT Still University Physical Therapy Program i le luafe luasfulu ma le lua il masina la le ne uni la sono o le tausana nei fa u mai ai tiare ma le Doctor of Physical Therapy mai le university o le AT Still University e na o ia fo le Samoa Hawaii i le senga fo mai e umai le tausanga nei mai le po university o le AT Still University o le AT Still University o le university fa po mai le po private medical school na fatuina le tasivani valua i Missouri mai todu la university Kirksville Missouri Mesa Arizona Santa Maria i California e tu sai was rau eka le panuolo tu wai le university Silia male afe to se lauli au fenga ruanga university mai la tala te fa fe se fa ka wa fa tangata ya onga ila onga ya ma tangata foi e o mai atu pe was fulu roa onga ile university mai abato foi la fatalo fa ma la masa il mata noanga ile ngana fa Britannia si to grow level malule tinu tal falava aloha Dr. Tiare Sanoe Laufou-Nakashima for our program this morning, Radio Samoa.
Hello.
Dr. Tiare Sanoe Laufou-Nakashima. Can you tell us a little bit about yourself and your parents and your journey towards being a doctor of physical therapy therapist?
Yeah, definitely. So my dad is from Mapusangafo, American Samoa, and my mom is from Molokai, Hawaii. And I was born on the lovely island of Oahu, and then I moved to Maui. That's kind of where we grew up and were raised, and all of my life we've been surrounded by the morals of just taking care of one another, humility, advocacy, and all that good stuff, such as like respect or even kuleana, responsibility. And so my mom was a registered nurse growing up, and I was always interested in the healthcare field just because of that ability to help others and hopefully give back to the community that raised me. So I always had an interest in kind of finding a field within healthcare to kind of provide that service for my community. And physical therapy definitely aligned with those morals. as far as kind of giving back to my community, kind of advancing that sense of well-being, and also just being that advocate for them.
Well, we're on Radio Samoa. Thank you for the time. And as you know, on Radio Samoa or any Samoan event, family ainga is important, or ohana in Hawaii. Your father, Tiare Laufou, is one of the most accomplished music educator in the state. If you have to describe him, or how does that look like? Can you talk a little bit about that?
So my dad, as far as describing him, one word that comes to mind is definitely determination. He had a dream. Him and his family relocated to California for a better life and for hopefully advancing his future. And my dad really plays a role in me kind of advancing my future and kind of seeking my dreams and just working hard to pursue them. And he's really the epitome of work hard, play hard. So he really established that emphasis of putting your all in everything that you want to do, but also remembering where you come from. And he has definitely helped pave that way for me. So I'm very proud and very grateful to have him as my father.
I checked on A.T. Still University. It was founded 1892. That's a long time ago.
And a very long time ago.
A.T. Still A.T. Still University was the world's first osteopathic medical school. What is osteopathic medicine?
Osteopathic medicine basically takes into consideration the entire person. So the mission of A.T. Still University, which is something that I very much valued, is just seeing the person as who they are rather than a diagnosis. So we really take into consideration the body, mind, spirit, and soul. And that's basically the standard and the foundation of my school's program.
Mm-hmm. That's important. So what motivates you to become, a doctor in this field?
What motivates me the most is my parents. Being the only Pacific Islander and the native Hawaiian in my cohort, I really had to strive to kind of educate my classmates and even educate my professors of like where I come and what my culture is. And the reason why I pursued this profession and this career is because it allows me to interact with my community one-on-one. It allows me to treat them beyond the diagnosis. It allows me to really establish that trusting relationship and building that stepping stone towards patient advocacy. Because a lot of times Pacific Islanders are unfortunately overlooked in the healthcare system, so I'm hoping that me becoming a doctor will kind of provide that stepping stone and bridge that gap.
Mm-hmm. You mentioned, I guess part of it is culture. Does a Palangi look at therapy different from a Polynesian idea therapy? Are there cultural differences or cultural-specific views or expectations and outcomes? How do you navigate that?
Yeah, I think as far as cultural differences, I believe there is like a shift happening currently where they're starting to understand more about the psychosocial factors. So looking beyond and kind of considering the person's upbringing, considering their cultural standards and their cultural morals. So that's something that has been instilled with me, and I'm fortunate enough to have educated a lot of my classmates who were just like unsure and just were very unclear of how to deal with these kind of psychosocial factors. But I'm very proud to say that the healthcare here is kind of making that shift towards addressing these.
Mm-hmm. What's the one thing that people misunderstand about your career or about this area, physical therapy?
Yeah. So as far as physical therapy goes, I feel like the biggest myth is that we just provide massage, and we're often kind of grouped together with massage therapists. But one thing about physical therapy that I really enjoy is that you get to work with that person's goals. So that person's goal is kind of used as your milestone. So you get to work more towards that function. You get to work towards those social interactions. So it takes more, it's not so much of a passive therapy or passive interventions that we're using. We're using active movements, and we're using our entire bodies to promote that well-being.
Mm-hmm. What is the the exciting moment and maybe most surprising thing you've learned during your physical therapy journey and your education?
I think the most surprising thing during my PT journey is I originally went in really wanting to work with kids because I had a really impactful internship in high school where I got to work with children with disabilities. And throughout my PT journey, I've grown to really enjoy working with neurological conditions such as Parkinson's, stroke, or even traumatic brain injuries, and just the amount of fulfillment you get with working with the patient, but also their family, just creating those little milestones and helping them achieve them was probably the most surprising part for me.
Mm-hmm. In Samoa, they just started not too long ago a medical school. What are the chances that would you be open to an idea of a lecture or being part of that staff in the future, or or something like that, helping out our Samoa or American Samoa?
Yeah, definitely. I think going down the future, this is something that I would love to do because this is the community that raised me and this is where I come from. So just being that kind of stepping stone and being that person that says, hey, if you have this dream, go ahead and pursue it. And one thing that I really love to advocate is just diversity in healthcare, because whether it's my parents in the hospital or if it's a loved one in the hospital, I would want them to see somebody that they see. And I want to be that voice for those people, and I want to hopefully share that and advocate that through my practice.
What's your advice to a student, a young person that wants to get into your field, physical therapy, and in medical school? What are some of the points that should be stressed to them?
Yeah. As far as students or even people that are aspiring to be a physical therapist or working in healthcare, it's just putting yourself out there and not being afraid of rejection, because the worst case scenario is somebody says no. And that's just a great way for us to grow from it. That's just further potential. And another piece of advice is it's going to be a difficult journey, but trust the process. And it's definitely worth it in the end.
And, your doctor of therapy, physical therapy, how do you explain that to somebody who don't really understand that whole idea?
Yeah, definitely. I think this has kind of been a talking point a lot with the physical therapy profession, because before it used to be a bachelor's degree, then it became a master's, and then now it's become a doctoral degree. And if I was to explain it to somebody, it's taking the idea of you have a goal. Let's find a way to get you to that goal by moving your body, creating like an active lifestyle, and pursuing that notion of well-being.
And you're a parent now, and what's your advice to parents who have young children who might be interested in this field?
Yeah, so we actually have a fur baby, a dog named Bond. So I'm not too sure if I could give the best advice as far as human babies, but patience is definitely key. I think it definitely relates to also having a puppy. We got him at a very young age, and just having that patience, because a lot of times it can be a little bit difficult, whether it's potty training or even just teaching them obedience. Just learning how to adapt in the moment, but also learning how to love each moment, because when we got our dog. He was very small. He fit into my arms very cutely, and all of a sudden he's grown up so quickly. So just taking a snapshot as much as you can and just really enjoying those moments and being present.
Mm-hmm. I know you're the only Samoan Hawaiian graduate with a doctorate of physical therapy at the school. Are you the first or the only one?
From my knowledge, I am the only one in my cohort. I believe there were possibly other Pacific Islanders who either graduated with a PT degree or an occupational therapy degree.
But at the doctorate level?
At the doctorate level, I would say I would be one of a handful.
Mm-hmm. Okay. Well, any final thoughts about, and some words of wisdom for our listeners, especially students out there?
Yeah, definitely.
Dr. Tiare Sanoe. Yeah.
Definitely. I just wanted to thank you guys so much for allowing me this opportunity to share a little bit about my story. And me personally, this was kind of a challenging feat for me to achieve such a degree. There are definitely moments where I questioned myself. There are definitely parts of me that had imposter syndrome. And I think one of the greatest things that pulled me through those difficult moments was definitely my strong faith in God, and also having like the strong support of my family and my husband. And I wouldn't have been able to achieve such a great achievement without them. So always remember where you come from, and just be grateful for having that stronghold and just that concept of family.
Yeah. I just remember something. One quick question in just a couple of seconds. What was your dissertation then for your doctorate degree? I mean, what was the area that you focused in?
Yeah, definitely. So as far as kind of like our dissertation or our final project, I was very blessed to be a part of a project that looked at social determinants of health. And these are basically outside factors where we live, eat, work, study, play. And social determinants of health look at how these factors affect our well-being and our health. So I was very fortunate to kind of dive into a study and an educational technique with our first-year PT students, just so they could observe in the clinic, observe social determinants of health, and then kind of see where the gaps are, as well as create resources for their clinics, their clinicians, and for their patients.
The Pacific Islanders have a disadvantage in any of these factors or vulnerable to it?
Definitely. From my research, I have seen a lot of factors such as language barriers or even job stressors or educational stressors. Those seem to be a lot of the biggest impacts when it comes to Pacific Islanders receiving care. So that's something that I really wanted to look into and kind of discuss with my research group. And that's something that I hopefully can dive into in the future and maybe even provide a lecture about.
Okay. Well, thank you so much. Thank you very much for taking out your time. I know you're very busy, but I want to thank you and mahalo aloha papitele lava Dr. Tiare Sanoe Laufou-Nakashima.
Perfect. Thank you guys so much, and I hope you guys have a wonderful day.
Okay, papitele lava. Thank you so much. Have a great day, a great week. Thank you. Dr. Tiare Laufou-Nakashima. They said, isa matandang litao, o lebano po o tato po kalame, o whaalawiloa leo alo Samoa ua ausia ia po matati a linea tunu. To tele labo tato tangate le leita longa, ia epi o le sila vaenga o le sini Pol man lo tio ta po kala me fala lo le ta o la o onga ma ka tio fo o ye fa na ma lo le tunu istonu fo o le tunu io sina tala na ma ta tu ripoti nei ta o e poi sala la fu ne ai nga manga lu se le o la ona ai a mo terminei so fo